Well, David, thank you for joining me today on the lead seat. I appreciate you taking time out to speak with me today on leadership and mental health. Um, before we get started or kick off, tell me a little bit about your background so my folks know a little bit more about you.
Okay. Well, thank you, Marilyn, for inviting me. It's a pleasure to speak with you. I'm based in Boston. I'm a medical doctor, a psychiatrist, and I am also an executive coach. So I've been a practicing psychiatrist doing work with adults, psychopharmacology and psychotherapy for over 25 years. And about 13 years ago, I added executive leadership coaching to my professional practice for a variety of reasons. And so I practice both now. I have two separate practices. In some cases, people come to me and work with me as their doctor, and I may give them a mental health diagnosis and treatment with medications or psychotherapy. I have a separate practice where people may come to me where they're facing some kind of career dilemma or roadblock or just wanting to develop further as leaders and enhance their careers.
Mhm.
And I do straightforward coaching with them, but there is a ton of overlap
Mhm.
in terms of just asking the right questions, helping people gain some additional insight and self-awareness about themselves, and making action plans and
Mhm.
holding themselves accountable to improving their lives, both their personal lives and their professional lives. So I see a lot of overlap, but they are two separate professional
Okay.
practices,
Oh,
both of which I'm working in actively to this day.
okay. All right. Well, thank you for that. I'd like to, what my thoughts were for today, as far as some things that maybe we could address is talking about, mental health and leadership, maybe burnout and leadership, the neuroscience
Mhm,
of leadership. So let's start out with maybe burnout, okay, and then we'll move
mhm.
to how to prevent that and other areas. So, what would you say are some of the early warning signs of burnout that leaders should look for in themselves or in their team, in their teams?
Well, burnout is increasingly recognized over the last several years as a major problem that people should be watching out for in themselves and also with colleagues in their companies, as you're suggesting. In 2019, the World Health Organization redefined burnout to refer specifically to mental health changes and difficulties that people experience in the workplace. Before that, it was a more general term. Like, you might burn out from personal life stuff, relationship or family stuff, but it got a much more specific definition in 2019 where people really, their energy is depleted, and they're feeling more negative or even cynical about their jobs, and
Mhm.
people's well-being and performance declines significantly.
Mhm.
So, what should we be looking out for? Well, prevention is certainly the best way to approach this. Once
Mhm.
people are into a burned out state, it can be very difficult for bosses or employers to engage them because you get into some very sensitive issues about whether to um, how to guide somebody into treatment. There are certainly resources in the workplace like EAPs and other uh,
Mhm.
approaches like that, and wellness programs and mindfulness programs. But clearly, the prevention of burnout is the best way to go if you want to take a more proactive and intentional approach to workplace mental health.
Mhm. What would be one thing that, because I'm thinking of myself, and for me, when I start approaching burnout, my body physically starts to tell me it's time to
Mhm.
sit down.
Yep.
So, what would be maybe some strategies or some habits that you could, maybe anyone, a leader or anyone else, could they do to kind of avoid getting to that point where, you know, before we get to the burnout piece?
Yeah. Well, as both a psychiatrist and a coach, I like to
Hmm.
try to help people keep it simple and focused. And for the vast majority of people, a good, healthy sleep schedule
Mm,
is
okay.
usually the first thing I think of. There are definitely other things, and for each individual, of course, it's a bit different. For some people, it might be exercise or meditation or yoga that is their main go-to thing. But sleep really is worth highlighting in this discussion. If people are sleeping well, 7, 8 hours a night, falling asleep pretty easily, staying asleep through the night, and waking up feeling rested, the chances of burnout go way down. And uh, it's very unlikely that somebody is going to be burnt out if they're getting excellent
Hmm.
sleep like that. So bad sleep can cause burnout. Burnout of various varieties can worsen sleep, and it can be a very negative cycle.
Hmm.
So
Hmm.
one of the first things I talk to clients about is how are you sleeping, and is there anything you can do to improve your sleep? Then, of course, as I was mentioning, there are other things to look at beyond that: exercise, mindfulness, nutrition, downtime from work, creating boundaries from your email and devices, uh,
Hmm.
time with your family, socializing time. But if there's one thing I'm going to focus on, at least as a starting point, it would be sleep.
Okay. Okay. Um, I have no problem sleeping. That's never
That,
been a problem.
that's good. Well,
Yeah,
then,
right. I never had a problem with that. I do know people that are very nocturnal,
mhm,
and I'm like, I don't get it. You know what I'm saying? But they can operate on a lot of sleep, on
mhm.
little sleep, on a little bit of sleep. How can a leader kind of create a work culture where burnout is actively addressed and it's not ignored or stigmatized?
Mhm. Well, um, first of all, I generally suggest that leaders model what they're trying uh,
Okay. Hmm.
to promote in the workplace. So, just as an example, if a leader is talking anti-burnout language to people, but then is sending them emails at 11:30 at night, or asking them to do things over the weekend that aren't life-threatening emergencies for the
Hmm.
company, then they're really working at cross purposes to their stated message. So uh, I think that is generally the starting point for employers or leaders, is to look at their own mindset and behavior and make sure that they're not burning out and that they're acting in ways that model um, not burning out.
Hmm.
So some of it may be providing programs, wellness programs, mindfulness programs, massage chairs, ping pong tables. Like a lot of companies have come up with
Yeah.
different
Yeah.
things to do that may be very helpful. But ultimately, the workplace culture has to be set up in a way where people's personal time and the boundaries are respected. People are encouraged to manage their time and set priorities in a healthy way. And a lot of that is based on respectful dialogue within teams about how to get the work done in a shared and collaborative way.
Hmm. Okay. I
So
that
a lot of it should just be implicit. Some of it should be stated, and then a
right.
lot of it should be filtering down from the top.
Hmm.
Leaders who demonstrate that you can be successful without burning out.
Okay. I know that you go into offices nowadays. I don't have an office where I go to the office every day, mostly out of my home office. But when I have been on client site, they look a lot different
Hmm.
than they used to look 20 years ago. I will say even 20 years ago, as little as 20 years ago, as far as the things that you see that they have for employees.
Hmm.
And like you say, you may come in and you'll see a lounge where they can sit and take a break, or you know what I mean, just kind of chill
Hmm.
for a little while. You may see a playroom where they
Hmm.
can do some type of ping pong or snooze ball or something like that. It's just
Hmm.
where I think you're right, employers maybe are thinking let me prevent the burnout by giving them some things. That doesn't mean that they're not doing their work. It
Right.
just means they need to take a little time. Let's talk about mental health and maybe training programs. Are you familiar with any kind of formal leadership training programs that include a mental health awareness piece to it? Or what would you recommend when it came to that type of program?
In terms of training, like
The
coaching,
leaders. No,
to,
like in terms of like training leaders, um, like a program, let's say a training program or a leadership training program that would incorporate mental health awareness, okay, and prevent
Hmm.
burnout. What would be some things that you would suggest or recommend be in a leadership training program around that?
Okay. So, for example, one specific program
Mhm,
is based at McLean Hospital and Harvard Medical School. It's called the Institute of Coaching. They have
mhm,
a lot of resources on their website as well, but it's usually an annual conference that's gone on for many years, both for people who are coaches and also leaders who want to bring a mental health awareness
mhm,
to into their organizations and companies and have that be part of leadership development.
mhm.
That's one resource to
Okay.
yep, the
Have,
Institute of
have
Coaching.
you attended? Have you ever been to the
I
conference?
have,
Okay.
yes, especially early on when I was getting into executive coaching and getting certified. I went to many of them, and then some of them they went virtual around COVID, and
Right.
now I think they're still doing some virtual programs and some in-person programs in Boston.
Let's talk a little about the impact of psychological safety on organizational health.
Mhm.
Um, can you let me know what is psychological safety and why do you feel it's critical to leadership effectiveness?
Mhm. Well, in this context, psychological safety is generally defined as a context in which people can bring up ideas and brainstorm,
Mhm.
even share ideas that may sound stupid
Mhm.
without negative judgment,
Mhm.
criticism, or reprisals in any way. So that there's lots of open dialogue. It's okay to make mistakes and be experimental within a shared group context.
Mhm.
And there is a lot of research on it. One of the premier researchers, say the premier researcher on psychological safety, is Amy Edmondson at Harvard Business School. She's published a lot on it. Her work is definitely worth looking at. Uh, and there's been a lot of research over the last 10, 15 years that demonstrates that psychological safety is kind of the main underpinning for high performing teams. There
Hmm.
was a study done by Google within Google that they called Project Aristotle. And what they wanted to understand was what distinguishes their high performing teams from their lower performing teams. So
Mhm.
they looked at lots of characteristics of individual members of the teams. That was how they started.
Mhm.
Years of experience, uh, education, that type of thing. Um, all individual characteristics of team members, and they had a lot of difficulty kind of sorting out any predictors of what would make a team high functioning versus low functioning.
Mhm.
So they went back and gathered more data and analyzed the additional data. And what they found was that the leading factor was whether the teams had created an environment of psychological safety or not. So the teams where people could speak up, share ideas, even if they seemed uh, out of this world or off
Mhm.
the beaten path, or again, even just plain dumb. If people could be openly having a dialogue and feel comfortable with that, those teams did a lot better than teams where people were more constricted or worried about what they were saying.
Mhm.
So, and then there have been lots of other studies beyond that, but the Project Aristotle study really stands out um,
Okay.
as a great exemplar of why psychological safety works.
Mhm. Mm. And when I think about it, I think about the leader that I've known, leaders that I've known over the years, and you're right, their teams want to perform for them
Hmm.
because that little internal department, that leader has made them feel safe, um, and want them to feel that they can openly contribute
Hmm.
to the success and the results of whatever their work may be. It's sort of like I think about when you're in school and you have that teacher,
Hmm.
one teacher that you go to their class and it's like you love going to that class. You don't want to miss their class because and you really want to do the work, do the school work, you know,
Hmm.
those teachers a lot of times are far and few between, but I can remember some teachers that just made me, I can't wait to go to class. I love
Hmm.
doing the work that you have to do for the class to pass the class. And they just gave that feeling, in the classroom that you were safe to express what you wanted to express. So I think that, it kind of starts kind of there. And
Hmm.
it kind of takes somewhat of a special person to have that kind of personality to really want you to come along with them and for you to feel safe to do that. Um,
Yes, and one of the things psychological safety is not is that
mhm.
people you can't ever be given critical feedback. I think
Oh yeah.
sometimes it's
Yeah.
misunderstood as um, it's only going to be nice.
Right.
Sometimes psychological safety does involve people, giving each other constructively critical feedback,
Mm-hmm.
done respectfully, of course, but it doesn't mean that you'll never feel upset about something.
Hmm.
But it does mean exactly what you're saying about the teachers, that you're inspired to keep going,
Right.
keep trying to get better. I know when I think back about some of the inspirational teachers I had, they actually pushed me, and
Yeah.
if something I did was not of the highest quality yet, they were direct about that, but
Hmm.
also, very supportive and encouraging of getting better.
I'm
So,
getting that. Hmm.
yeah, so it is about being able to feel safe and share ideas, but also it does require people to be able to be vulnerable also, and to keep rising to the occasion and improve the quality.
Hmm. Oh, when we talk about psychological safety and mental health, how do those two intersect in
Mhm.
the workplace?
Well, in environments where people don't have the kind of psychological safety we've been talking about, where they
Hmm.
can be creative and talk freely and feel
Hmm.
connected, they're at much higher risk of a number of mental health issues. We've talked a little bit about burnout, and certainly there's that. But other mental health issues, especially in people who are already vulnerable to
Hmm.
psychiatric disorders, also can become higher risk. Major depression, anxiety disorders, attention deficit disorder, uh, and even physical medical health conditions, high
Hmm.
blood pressure, asthma, diabetes, all of those can get worse when people are in chronically stressed workplace situations.
Hmm.
And I've seen many people, both in my psychiatry practice and coaching practice, who have had to take medical leaves of absence as a direct result of a toxic work environment. It's one of those things, referring back to my own career journey at the beginning that we discussed. It's one of the reasons I moved from psychiatry to adding executive coaching,
Hmm.
because so many of the patients I was seeing in my psychiatry practice were getting like physically and emotionally sick as a result of their jobs
Hmm.
and the pressures in their careers.
Right. Right.
So
Okay. Yeah, I saw something, I was looking, I think it was on LinkedIn, and I saw a young lady that a before and after,
Mhm,
and it was like she was at the point of burnout on her job and
mhm,
had spoken to, this is where I was and how after she let the job go,
mhm,
the aftermath was, I mean, totally different look. She looked
mhm,
totally different. But that's what she was saying, not letting that job, take you there to a place where she felt that she was really, and you could just see it on her face because it was like a before and after picture, and you could just see the
mhm,
difference on her face after she left and went and took care of herself, basically.
mhm.
Difference, big difference. So that is so true. So what does mindfulness mean in the context of leadership? And how can we practice it daily?
Mhm.
Or what could be a practice for it daily?
Yeah, now mindfulness has become a big term that
Hmm.
incorporates many different um, techniques
Hmm.
to sort of settle and focus the mind, reduce stress and anxiety. So some of the mindfulness techniques that are most popular these days are various forms of meditation
Hmm.
and yoga. But if we go underneath, like what is the core of mindfulness? Um, my understanding and the way I talk with people about it is that it is getting the mind focused on the present moment and acknowledging what's going on within your body and your personal experience in whatever moment without trying to change it, but more to just gently notice it.
Hmm.
So, my shoulders are really tight. Um, the idea with mindfulness is not to take a pill to make your
Hmm.
shoulders less relaxed, although
Right.
that may be part of the approach as well. But the strict mindfulness approach would be to slow yourself down, notice that your shoulders are tight or your arms are clenched, and then engage in some kind of mindfulness activity, such as deep breathing with a longer exhale than an inhale. Maybe a count of 4 on the inhale and to 6 on the exhale. Uh, and gently notice and accept that your shoulders are tight. The paradox of mindfulness there is that by just noticing it and trying to just see it, feel it, and not change it, is that it does change.
Hmm.
It's a very disciplined exercise in noticing self-awareness.
Hmm. Hmm. I've heard that before. That gut instinct, sometimes you get that feeling in your gut and it's a mindfulness. It's like your body kind of tells you what, but it's the being able to pay attention to it because in our daily lives we're moving so fast, we're doing so much. It's like we overlook it or just um, ignore it to
Mhm,
say instead of taking, like you say, that time in the moment. And
mhm,
sometimes I think people feel that I can't do that right now. And
mhm,
so if a person was like, well, I can't do that. I know what you're saying. I can't do that right now, because of whatever the circumstance may be. What would be kind of your advice to a person that had that type of attitude about the mindfulness? I can't stop. I got to keep going.
well, I don't try to talk people into mindfulness. The people that are willing to start doing it are usually the ones who have noticed that what they're doing is not working very well, and they need some kind of change. And I think most of us in our lives have gone through periods when it's just all go, 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 and
Right.
and
Hmm.
just not don't really have the capacity or the bandwidth for it. Um, at the same time, we really all probably have more capacity and bandwidth to do it than we realize. Um, I walk out the door and walk 40 feet to my car in the morning, for example.
Hmm.
You can't be answering emails or doing anything during that. I suppose you could, but you don't. do, you can put your phone away and take some deep breaths while you're walking to your car, or while you're brushing your teeth. I don't think mindfulness depends on taking out a half hour, an hour of your day to sit on a cushion with your legs crossed and breathe, or take out an hour of your day and go to a yoga class. I mean, it's wonderful if you can find the time for it and you
Mhm,
have the inclination. Many people really benefit from that.
mhm,
But even in the course of really busy lives where you may be working 10 to 15 hours a day, there are periods of time where you probably could get 30 seconds or a minute or 2 minutes to just slow down and notice what your mind or your body are experiencing.
mhm.
Brushing your teeth, for example. There's probably not much else you can be doing while you're brushing or flossing, but just noticing the sensation of the bristles over your teeth or
Uh-huh.
the floss between your teeth, and breathing while you do it, for sometimes is enough, and it can start building a habit of mind.
Mhm,
People then may be able to build on that and expand the mindfulness practice. So I know personally for myself and with many people I talk to, is like, don't try to do a yoga class an hour a day. That's not realistic.
mhm,
It probably is realistic to find a few minutes here and there to deepen your self-awareness.
mhm, mhm. Um, you know, emotional intelligence. I didn't think I wanted to go there, but I think, that's a big thing, now in leadership and
Mhm.
having this emotional intelligence. And so I was kind of looking here um, about EQ, and there's just so much out there, and you can see it in so many different ways.
Yeah.
So I think I want to come up with one question around this when it comes to mental health and the emotional intelligence. What are the key components of emotional intelligence that contributes to maybe better decision making, and how do they prevent burnout?
Mhm. I mean, I think of emotional intelligence, with some overlap with mindfulness, and that
Mhm,
you went from mindfulness to emotional intelligence in your inquiry here with me, which I think makes a lot of sense, Marilyn, because so much of emotional intelligence is also about awareness,
mhm,
awareness of what's going on with yourself emotionally,
mhm,
and then the capacity to read what may be going on with other people around you. The biggest barriers to emotional intelligence, I think, are stress and overwhelm. And maybe, as we were discussing before, not enough sleep. So when your
mhm,
brain is in a suboptimal or exhausted or distracted state, or certainly if you're depressed or severely anxious or burnt out, there is less capacity
mhm,
for awareness of oneself and awareness of other people. So I think emotional intelligence also overlaps with social intelligence. Some of emotional intelligence is about knowing yourself and what you're experiencing.
mhm,
Some of it is about being able to read the room, and have empathy and compassion for what other people are going through.
mhm,
So what I find with a lot of clients is that the emotional intelligence is not usually about like being autistic. That's a very small percentage of people that have any form of severe autism,
mhm,
or about being, narcissists.
mhm,
Oftentimes, people with emotional intelligence are labeled as very autistic, on the
mhm,
spectrum. What a narcissist. Those people, when you get to know them, are often really stressed out, scared, worried, and possibly dealing with some kind of mental health disorder like depression or anxiety or bipolar disorder.
mhm.
Uh, so, my approach with emotional intelligence is usually to help people optimize their basic wellness.
Okay. Okay.
And mindfulness may be one of the ways to go about that, because again, mindfulness and emotional intelligence really are about awareness.
When self-awareness. Yeah. um, we know if nothing else happens in our lives, there's going to be change.
Mhm,
Change is inevitable. So I wanted to kind of maybe talk a little about mental health considerations when we're going through change or a
mhm,
transition period. So, what would be some strategies that leaders could use to provide psychological support during an organizational transition?
mhm. Well, just like with emotional intelligence and social intelligence, there's a self-care aspect of
Mhm.
dealing with change management. And then there's the focus on helping to take care of other people around you,
Right.
individuals and groups of people. So, with taking care of oneself, what I often find I'm talking about with people is with all the change, uh, this may be an opportunity to kind of revisit your core values.
Okay.
What are the things that really make you tick? What are the things that you care about the most in your life, whether it's workplace and career-oriented things, or going back and thinking about your family or reconnecting with friends. So that's at least one of the approaches to dealing with change is seeing it not just as a stressor, but also as an opportunity to be introspective and revisit your core values. It may also be an opportunity with other people in your organization or company to have similar kinds of discussions. There's so much going on here. It's so uncertain and volatile. Let's have some dialogues about what really matters the most to us. What are we really good at? What's our vision and mission? Let's do some more strategic thinking. Because
Mhm.
when there's so much change and uncertainty, it's very easy to get wrapped up in the whirlwind of the day-to-day logistics and operations, um, and just sort of increase the stress and overwhelm.
Mhm.
But also taking some time to step back can make a big difference, both in terms of emotional wellness and mental health, but also possibly in terms of vision and strategy. So I think my main answer to the question you're asking about managing change is revisit core values.
Okay. What role does communication play in reducing anxiety and stress during periods of transition?
Well, there's many forms of communication here, I suppose, whether it's on the personal side with family and friends, with peers and colleagues or bosses at work. Uh, Being a psychiatrist and coach, I tend to think dialogue, the more dialogue, the better. But the question is really what kind of dialogue are people looking for, and what do you want to provide?
Mhm.
And going back to uh, active listening and asking good open-ended questions is usually the way to go.
Mhm.
What's causing the most worry here? What have you done to reduce the worry and the stress? What else do you need? Who else can help? Avoiding giving too much advice or falling into, as the title of the book, the advice trap talks about. Uh, Avoid giving too much advice or even seeking advice. It
Mhm.
is more about seeking just what you're asking about, which is dialogue, asking
Mhm.
questions and trying to help people or help yourself solve your own problems.
Mhm.
Again, and when there's so much stress and change going on, it is hard to slow down and have those types of more open-ended dialogues. It's much easier to jump in and give somebody advice
Mhm.
or just look for a hack to
Mhm.
to get through the day.
Mhm.
Slowing down, and here's where the mindfulness may come in again. Slow down, have the awareness of what you're experiencing, whether it's in your body or the mental chatter in your mind, and slow down and think about who can I talk to about this,
Mhm.
and also how can I change my internal dialogue.
Right.
When I hear your question about communication in this situation, a lot of it is about who else we're talking to, but it is also a question about how we're talking to ourselves.
Mhm. I know. for a leader through the years, one that was honest and open and
Mhm,
just willing to, um, you know, be willing to um, let you know what's going on. Or I felt more, I would gravitate to more of a leader like that, that was honest and open about whatever the change or transition might be about. And I think it also relieved that energy, relieved a lot of stress, or uncertainty for people
mhm,
that may have been because they're wondering what's happening or what's going to happen with me, what's going on with me, how is this going to
mhm,
affect me.
mhm,
So that leader coming from a place of being honest and open, and
mhm,
which it leads into mindfulness too, like you say, is what for for me is what that communication style I like, open and honest. Let them know this is what it is, and if I don't know, I'll tell you I don't know either, but having that open communication, that honest, open communication.
I agree. I think it's a really important point that directness and honesty and
Mhm.
just stating facts is
Right.
very helpful. An employer or a boss doesn't need to become necessary, certainly not a doctor or psychiatrist, and
Right.
may
Yeah.
have some coaching functions, but not even a coach. It's just stating facts and asking
Hmm.
people
Right.
what they're doing and what kind of support they might need. There are some people that may want a lot of dialogue with
Hmm.
colleagues or boss, and others who only want to hear the facts and then they'll go deal with it separately. And everybody should be,
Right.
respected in
Right.
that way. But it does start with respectful honesty, as you're
Mhm.
suggesting.
Mhm.
It's often when the facts are unclear and confusing, and there's a ton of uncertainty
Mhm.
that people lose sleep, get anxious,
Yeah.
don't focus. People's ADD or depression gets worse, and then it's a spiral down into burnout or even worse than burnout with mental health disorders.
Mhm.
Uh,
Okay.
but so, sometimes the environment is so uncertain that nobody right up to the top of the organization doesn't know. And then
Right.
that should be stated also.
Yeah.
We just, here's the story. We don't know. We're in a VUCA
Right.
situation and we're
Mhm.
all dealing with it together.
Mhm.
What kind of support can we give each other?
Mhm.
Ask an open-ended question.
Okay.
Yeah.
David, this last area that I wanted to kind of dwell into is around enhancing executive cognition.
Okay.
And so one of the things I wanted to ask you about was, um, get it right here. Oh, how can coaches help executives identify cognitive biases that hinder their ability to think critically and make balanced decisions?
Mhm. The foundation there for the coach is asking good open-ended
Mhm.
questions that get the client to think,
Mhm.
slow down and reflect on what they've just said.
Mhm.
Sometimes the coach may point out inconsistencies in what people are saying, not as a gotcha moment, but more as a moment to ask for further dialogue and clarification. What are you really thinking here?
Mhm.
Uh, it it may be that there's really doomsday, negative, catastrophic thinking going on that is inconsistent with facts. I often find that I'm saying to clients that, it actually sounds like the truth is on your side here. Why don't we look
Right.
at why don't we what are the facts that you've stated that actually are positive? And sometimes it's answers like, well, we've been having trouble getting new clients in the door, but we have some clients who have been with us for 10 years and they're sticking with us.
Mhm.
And we're going to be able to get through it. And then maybe over the coming months, we can think about bringing new clients in. So we're at least keeping the lights on.
Mhm.
Okay, well, that's an important fact that wasn't being focused on. So, uh, pointing out areas where there's some kind of inconsistency or non-fact-based thinking is often the way to go.
Okay.
Again, it involves helping people slow down to actually think about the truth.
Hmm.
In many cases, the truth is better than people realize.
Hmm. And
Uh,
when it comes to self-awareness, what role does that play in cognitive improvement for executives?
well, it's really impossible to change your mindset if you don't have an awareness of what your mindset currently is.
Okay.
Um, so, uh, so I do find it very helpful with many clients to get them to, like I keep saying, slow down. There's got to be some pause moments here to articulate or write down what their core thinking is,
Hmm.
and then to look at it and say, is it evidence-based? Is it factual? Um, what parts of it make sense? What parts of it look like they're inconsistent or falling apart? Or when you say them out loud, you realize that it's really way off base.
Hmm.
So starting with that mindful awareness of what your mental chatter is and what the mindset is often the right starting point, because people are often defaulting into a mindset. Once they notice what it is, they can start getting out of out of that mindset. Uh, I worked with a client who was an executive level person in the healthcare industry, and a new CEO was
Hmm.
coming. She was very nervous about the new CEO, and she kept saying, "I don't know what it's going to be like to work for this person. Uh, I've heard this person is really tough and really inflexible and really judgmental. I don't know what it's going to be like to work for him." So I heard that sentence multiple times over a few weeks. And I asked her to just write it down because I said, "You keep saying this. Why don't we go into a little more detail on that
Right.
sentence?" So she wrote it down. I don't know what it's going to be like to work for this CEO. And then as I reflected more on it, I realized, there's one word in that sentence that may be the difficulty here. And I asked her to look at it.
Hmm.
We agreed that the problematic word there was the preposition for. I'm worried about working for this CEO. And with one shift of word, her mindset changed. She had a good sense of humor, and she was able to pause. And so I said, "Okay, what's another preposition instead of for?" And she said, "Well, how about around?" I wonder what it'd be like to work around the CEO. So we both had a good. So, and that's another aspect of it, is humor in executive coaching,
Uh,
which I find like just a very interesting topic.
right.
As soon as some humor starts getting injected, you know
Hmm.
you're getting somewhere because people's minds are more playful.
Right.
It's very hard to have a sense of humor or to laugh or chuckle or have a sense of irony when you're completely overwhelmed or burnt out.
Hmm.
So
Hmm.
the fact that any humor came in there was like a very energizing sign to me. I'm like, okay, I think we're getting somewhere. And she was smiling. And then she said, okay, I'm going to put around aside. I think I know where we're going with this. The preposition I'm going to go for is just with. I wonder what it's going to be like to work with this CEO. And then all of the fear-based thinking about this went away. And she developed an action plan, which was very simple. I'm going to send him an email and see if he'd like to meet. And ask him, what can I do to help you,
Hmm.
get settled into your new role as the CEO? This person had never been in the organization. In fact, had a background that in a different field. So
Hmm.
I said, I wonder, he might be more stressed than you are
Yeah.
coming in. I bet he's really,
Uh-huh.
it's like, again, I hadn't had that thought. And I think I framed it as a question, how worried do you think he is about becoming the CEO? And when she, again, paused and reflected on that, this is where some of the emotional intelligence comes in when you slow down. She realized that's probably really stressful.
Hmm.
He'd probably like to hear from other members of his team
Hmm.
that they're aware that he's there and they're willing to meet and help. And so she went from being anxious and fearful to reaching out and having lunch with him. And they, over the course of the next few months that I worked with her in coaching, they started to develop a very positive relationship on that foundation. So that's just one word, Marilyn.
Right.
You're asking about cognitive changes. Sometimes it's more like a phrase or a sentence or a paragraph
Hmm.
needs to change. But it does really amaze me at times that sometimes it's just one word that
Hmm.
shifts a mindset from fear-based into growth-oriented, and that can be the foundation of great leadership.
Hmm. Okay. Thank you for that story. That was an interesting story.
Yeah.
Yeah. And I'm sure that a lot of times people have a similar story to that and how they've worked, and how did they work through it. Just changing that one word, that one shifted the whole view, the whole vision of the working relationship. Uh, David, that's kind of all the questions. I wanted to ask you, what else can you share with me around preventing burnout, leveraging development or growth
Hmm.
from a leadership perspective?
Yeah. Well, I do think it starts with self-care and a foundation of good physical and mental health, optimizing those things. I highlighted sleep early on. For many people, that's a very good indicator and bellwether for how well they're doing. Uh,
Hmm.
there is research that shows that people that get an average of less than 6 hours of sleep per night versus those who get an average of more than 6 hours of sleep per night uh, are rated lower uh, by peers and direct reports on the quantitative 360 assessment.
Okay.
Somehow people without even without sleep seem to pull it together for their bosses. But
Yeah.
uh,
Yeah.
so things like sleep, exercise, nutrition, taking
Hmm.
care of oneself physically,
Hmm.
having mental downtime, and social connectedness with friends, family, community, organizations, church, community activities. Those are very protective of mental health and put people in a position to go into the workplace with
Hmm.
their best selves and to be able to bring all the tools that are needed for emotional and social intelligence,
Hmm.
psychological safety,
Hmm.
respectful collaboration, and team building.
Hmm.
So that's sort of how I see things as a psychiatrist and an executive coach. There does need to be a foundation of basic physical and emotional health. And that is the foundation on which great leadership happens. And when people are thriving in their jobs, they often come home from the office feeling well and being able to cultivate the family and social relationships
Right.
that then feed back into keeping them healthy and able to go back to work.
Right.
So creating that positive loop of self-care and emotional intelligence and psychological safety in the workplace is really the foundation for leadership growth.
Okay. Thank you for that.